Back now at 7:41 with the latest front in the war on drugs. Turns out it's your medicine cabinet. NBC's Mara Schiavocampo is here to explain. Mara, good morning.
Erica, good morning. Nearly 15,000 people die each year from prescription drug overdoses, and it's creating what experts are calling the nation's fastest growing drug problem. Many of those who are affected aren't taking pills to get high, but to get better, following a doctor's orders and accidentally developing an unshakable addiction.
It's he and my dad, the two inseparable ones.
When Jennifer Cassidy looks at old photos of her brother Aaron, she still sees the picture of health.
He was that guy in high school, that starting pitcher for the baseball team, starting football, defensive end, very popular.
At 33, Aaron, a successful insurance salesman who loved music and working out, went to a doctor about some old sports injuries and left with a prescription for the painkiller Vicodin. Aaron had no history of drug or alcohol abuse, but his sister says he developed a powerful addiction to painkillers.
Came out of nowhere.
Though Aaron continued to feed his addiction with refill after refill, Jennifer says he desperately wanted to kick the habit. But 3 years later, he lost that battle, dying in his sleep of a prescription drug overdose at just 36.
We still beat ourselves up because we feel like we failed him. We just feel like he was so special. We just feel like we failed him. We do.
Tragically, Aaron's story is becoming all too common.
The fastest growing drug problem in the United States.
Prescription drug overdoses, mostly from painkillers, now kill more people than heroin and cocaine combined. More than triple the number from 10 years ago in what experts are calling an epidemic. Many of these patients get hooked by accident on legitimately obtained prescriptions for real medical problems.
EMS will bring the patient in and they'll bring in pill bottles, and they're always prescription medications. This is what they overdosed on.
In the last 10 years, prescriptions for powerful painkillers have skyrocketed after the medical community vowed to do a better job of treating pain.
Today, the emphasis is on relieving pain, relieving it quickly, and relieving it adequately for the patient.
In 2010, the amount of painkillers sold was 4 times greater than in 1999. Enough pills to medicate every adult in the country around the clock for a month.
In terms of the scope of the drug problem in this country, where would you rate this?
I would rate it at the top.
To tackle the problem, the White House is calling for better monitoring systems, more education, and stronger enforcement of existing regulations of powerful painkillers.
Essentially, they're synthetic heroin. I don't think we really recognize that. And now, of course, we're paying a terrible price in this country for that.
Like so many others, Jennifer Cassidy and her family know that price all too well.
The way the system is set up, unfortunately, makes it very easy for unsuspecting people to become drug addicts. There are so many people dying this way, and there's very little talk about it.
One family speaking out for all those who no longer can. Every state except Missouri has passed legislation for a prescription drug monitoring program, but they're only up and running in 35 states. Now, health experts say that while steps do need to be taken to address this problem, it's really important to remember that strong pain medication must be available for those patients who do need it the most. Erica?
Mara, thank you. Dr. Heather Lefference is a psychiatrist who specializes in addiction. Thanks for being with us this morning. It's a scary picture that's painted in Mara's piece there. The sister saying this addiction just came out of nowhere. First, how addictive are these drugs?
These drugs are very addictive. I think there's a misperception because a doctor prescribes it and it's a pill, but these are as dangerous as street drugs.
They're as dangerous as street drugs. A lot of kids we're hearing more and more about are finding them in medicine cabinets. So how do you stop this? If there's someone in your family who, like this young man who we saw, the family thinks there may be a problem, what are some of the signs that you look for?
Well, you would look for things like missing work, pursuing the drugs at the expense of other activities in life, getting into trouble with, driving complications, legal complications. And I think just being tuned into behavior in your family members or friends is important.
How do you then, though, wean someone off of them? Because there are people who do legitimately need a lot of these drugs to manage their pain. Is there a middle ground here?
There is. There really is. And there are a lot of treatments available, including medications. And so I would encourage, if you think that you or your family has any kind of problem with these medications, to get treatment.
And are there alternatives for people who are trying to manage their pain and then perhaps also deal with this addiction or wean themselves off of it? Are there pain medication alternatives that are less addictive but equally effective?
There are pain medications that are different. Of course, there are the anti-inflammatories, and also there are pain management strategies that don't involve medications that have been shown to be successful. Most of these medications should really only be used in the short term.
How concerned are you about this as a problem?
Very concerned. The CDC has called it an epidemic.
And you would agree with that assessment?
I definitely agree with that.
Some sobering news, but some good tips, Doctor. Thank you.
Thank you.
GOP and Democratic leaders departing the White House. We're going to keep our eye on that. But in the meantime, President George H.W. Bush remains in intensive care today at the Houston hospital. But after days of dire speculation, a family spokesman today offering some hope. Fox News' Mike Tobin has the very latest from Houston. Mike, you have an update, sir.
Yeah, I do. And the latest release, Eric, includes the phrase continues to improve in association with the former president's condition. Now, the staff around former President Bush has made an effort to be lighthearted with the releases and optimistic in all of them, all the while acknowledging that he is pretty sick and he's 88 years old. He is currently in the intensive care unit. The reason he's there is a stubborn fever that he just can't seem to shake. The fever was brought on as a complication with bronchitis, and that case of bronchitis caused the former president to be hospitalized here back toward the end of November. Now, the staff around him is being very judicious in terms of the information that they're giving out. In part, they say that's because he is so beloved that people will overreact if they get any information. We do know from that staff that he has been conversational with the nursing staff that is around him. If you've ever had an opportunity to meet this president or cover this president, particularly since his term ended, you would know that he's a very funny guy. He's a stitch a minute. So consistent with his personality, they say that he's cracking jokes with the hospital staff, but we now hear that he's taken it a step further and he's singing with the hospital staff. So you can interpret that as a good sign, all the while taking into consideration they're not in a hurry to move him from intensive care, not in a hurry to move him from the hospital. Eric.
All right, thanks, Mike Tobin. By the way, yesterday he was watching this show. We got word that he was watching the show and enjoyed the segment we did on it. Despite the president's improved condition, his doctors remain cautious. What could their concerns be? To Dr. Ernest Patti of St. Barnabas Hospital in the Bronx. He breaks it all down for us. Doctor, thanks for joining us. It's got to be a good sign if he's cracking jokes, as Tobin pointed out. As Dr. Siegel told us from the segment we did yesterday, he emailed them and let them know he was watching, he was having a good time with it. Sure, let's remember, those are optimistic things. He's cracking jokes, he's singing, he's interacting with the staff, all very positive things. Let's not forget, he's also a World War II veteran, and he's always had an optimistic personality. All these things are good boost to your immune system to keep you healthy. Sure. Doctor, tell us about this fever that we keep hearing about. At some point, we got to be concerned it's lingering. Definitely. Anytime you have a bronchitis or any infectious disease like that, your body responds by mounting a fever. That's to fight whether they're bacteria or viruses. What concerns me, though, is it's been on for a long period of time, and they haven't really seemed to have pinpointed the source of the fever. That's why I assume that he's in the intensive care unit, where they monitor your vital signs on a much more frequent basis, keep a closer eye on you, and can see if there's any improvement or, at the same time, if he worsens at all. That's why I think they have him there. Now, do you have any sense, I know it's very difficult to do from here, just from the reports we're getting, and again, a lot of the spokespeople are telling us some of the positive signs. Any sense on what your gut reaction to his condition is? Well, don't forget, he is in his 80s, and he's enjoyed good health, has some other health concerns that we're worried about. But talk to us about that. Well, I know from what I've been reading that he suffers from Parkinson's disease. And any time that you have other health concerns or health conditions that are affecting your health and well-being, that can put you at an increased risk for complications from other disorders, such as protracted bronchitis. Bronchitis can lead to pneumonia. Elderly people are prone to pneumonias. I'm not saying he has a pneumonia, but that's a concern that I'm sure they're worried about and monitoring for. So what they're doing is trying to figure out the source of his fever and trying to keep him well nourished. They mention he's on a liquid diet. Anytime you're under a protracted illness, your immune system needs to be nourished properly, and you need to have proper nourishment. It's tough to get when you're in a hospital setting, to get a good diet and exercise. So hopefully he's getting all of that while he's in the hospital. All right, we're going to leave it there, Dr. Ernest Patti. Thank you very much for joining us. The reason why I cut that short, can you pull that, Pam, can you get that shot? I believe that was Harry Reid getting into the SUV. I think that's his SUV right there. I believe he just left the White House as well. Pam, can you confirm that? Was that him? Yeah, okay. All right, that was him. Thank you, sir. Thank you,
very much.
Dr. Patti.